We've got Dr. Julian Ojebo joining us today. He is the first vice president of the National Association of Resident Doctors. We do remember that there's been a timeline. Governments have been meetings, government saying they were going to fulfill the promises made and to the doctors, as a result of which the strikes were called off. So let's get to Dr. Julian now. So tell us, is all well with the NARD now?
Good morning, Chamberlain, and thank you for having me. I'd like to start by saying thanks to Dr. Stella Ameya Adedevo, who died yesterday, 6 years ago. May she rest in peace, and we thank her for all the things she's done. Also, try to remember that during the outbreak of Ebola, she was at the forefront, and we do have another pandemic, COVID-19. Government has made so many promises. Chamberlain, you also remember 10 days ago, the Minister of Labour, Productivity and Employment did say that all the remunerations for 6 centres across Nigeria would be paid, and today is 10 days post when he said that, and these remunerations has not come. Of course, we do have to appreciate the fact that starting from where we did start sometime in June the 22nd, where we did decry the deplorable state of the health facilities all across Nigeria, both at the federal level and at the state level, we did say that we had paucities of supplies of personal protective equipment. We also did have issues with the fact that we're facing a pandemic and there's currently no form of life insurances for our members. Yes, we would say that there's been some improvement on the supplies of personal protective equipment, but I also do see at this point that it has also been epileptic. It is not to the level which we do expect that facing such a pandemic, we should have all of the facilities we need, all of the things we need. Also, at this point, I have to say that this is over 6 months, over 175 days since the outbreak of the COVID-19 in Nigeria, and there's all we have for COVID-19 treatment isolation centers are just makeshifts. We do not have proper structures to say these are facilities that after the pandemic, they're going to be used as facilities for management of infectious diseases all around the country. One will do expect that there should be some level of progress of work in specialist centers like the Infectious Disease Hospital in Lagos, like the Euro Specialist Teaching Hospital in Ira, Edo State. One would do expect that we're supposed to be seeing some level of improvement, but at this very moment, we still have so much to achieve, but we're hoping and praying that with more talks with different stakeholders at top levels, we hope that we will get all that we need in no distant time.
Of course, in terms of percentages now, a proper picture, how much of these promises have been fulfilled by the government? Is there anything to worry about, and to what extent?
So much to worry about, Chamberlain, so much to worry about. If you say, like I did say earlier, the health institutions in Nigeria are not just at the federal level. We also do have a lot of deplorable states in the state tertiary health institutions, as it were. These provisions, like we've said, they are not, I'd say they're less than 40% of what we actually expect. Should we be getting up to 60%, 70%, we can now say, okay, some eureka can actually be said, but at this very time, we can't say eureka yet because we do have a lot to achieve. Now, remember, this is August. We did talk about remuneration. We're talking about remuneration for COVID inducement allowances for June. We're still talking about provisions of personal protective equipment that we start talking about in June, in August. We're also still talking about life insurances, and we don't even have life insurance cover in every of these both federal and state institutions. So we can't say we've gotten to even the 40% I just tried to give now. We are still lagging behind, and I must say there's room for improvement, but we're hoping that executive appointees will live up to their words and actually do exactly what we expect them to do. We're not saying do all of them. We're saying come up so that we can meet at a particular point. And so, yes, there's so much room for improvement, and we're hoping that they will improve and try to sort these issues while they still linger.
Well, let's back up a little, Dr. Ojebo. I remember in the wake of this COVID-19 pandemic, on May 30, your association promised, you threatened to go on strike on May 30 over the COVID-19 allowance demands. And I remember that also that on the 9th of June, the House of Representatives, the Speaker of the House of Representatives, met with your leadership and the two ministers of health, and that was supposed to address some of the main issues. And as far as the Speaker was concerned, it was already done and dusted. Only for you to announce on June 15, to the chagrin of the Speaker, that, you are going on strike. You have actually announced that you have gone on strike. The doctors have also intervened. The Minister of Health also spoke. So in all of these, and then, of course, when you called off the strike on June 22, you again threatened on June 25 to go on strike again or resume the strike you suspended if things were not done. Are you saying that all the governors paid lip service, the House of Representatives paid lip service, and the Speaker of the House of Representatives paid lip services to all of the issues that you have listed in this demand?
Once again, thank you so much for these questions. I need to, at this point, make some clarifications to make you know that NARD did not embark on an industrial action for the sole purposes of remunerations. We decried the deplorable state of our health facilities. We decried the non-provision of personal protective equipment. We decried provisions, dilapidated state of health tertiary institutions. We also did decry the fact that we don't have life insurances for our members when they died. Some time ago, we did say on this TV channel that we've lost over 14 of our members from exposure to COVID-19 while in the course of trying to combat this disease. Now, we also do know that this is Nigeria, where there are a lot of bureaucratic bottlenecks. Okay, so we're thinking and we're hoping that if we can surpass these bureaucratic bottlenecks, we would achieve a lot. But at this interim position, we do not have so much force and push to push across those bureaucratic bottlenecks. So we still have this back and forth toss, and like we're achieving some progress today and tomorrow some bureaucratic bottleneck is holding you down and you go back 15 days from where you actually started from. So these bureaucratic bottlenecks are actually the major issues that we have at this moment. When we surpass those bottlenecks, I think we'll have some level of trust from the Nigerian doctors to the federal and state government. I'd also make you understand that when we did call out some state governors, like the governor of Ekiti State, the governor of Oyo State, some months later, we saw some level of improvement. The Excellency from the governor of Ekiti State did improve on the promises he actually did make. The governor of Oyo State did improve on the promises did make. While we see some states just practically not even listening to the yearnings of these Nigerian doctors. And I should inform you at this time that international travels are going to be open very soon, and we're going to be having so much of brain drain because we're not really tackling the fundamentals.
Tell us then, Dr. Julian.
I draw something.
Pardon me, let me just bring this in. So, in light of all that you've said, is the NARD considering embarking on another strike?
Chamberlain, the NARD, they are not strike mongers. We are open to negotiations, we're open to discussions, we're open to top-level discussions with any cadre of government that cares to listen to us. The Minister for Labour did reconvene. 2 weeks ago, we had a meeting with him. We're supposed to be reconvening today, being the 20th day of August. We're supposed to be having another meeting with him. And we're still going to make them understand. Executive appointees of government sometimes don't really understand our problems when we try to explain them. So we need to keep telling them so that they really understand where we're coming from. So we'll still be having another meeting with them today. And I'd say that the National Executive Council is on a recess at this moment. We shall be reconvening, but we won't be reconvening until after that meeting with the Minister of Labour. When we have that, we can now go and say, okay, our members, this is what we have on the table at this very time, and then we'll now be giving subsequent instructions from the National Executive as to what we should do. But for now, we're on recess, and when the recess is called off, we'll let the public know exactly what our plans are for with regards to the industrial action. But for now, we're on recess, and when we come back from that recess, everybody will know what we have in store.
But you say that you're not strike mongers, so do you want people to go with the impression that the NARD is not considering going on strike, even when you let the public know what your next steps will be?
Chamberlain, again, I'm just the second among equals. I can't speak for the generality of the NEC members, okay, but I can tell you that we are not strike mongers. We're ready to listen to the government and get to hear the offer that they give us. Once those offers are tangible enough, we can tell our members that, okay, we've had some level of discussions and these are the progress we've made. And then the National Executive Council will be taking that sole decision which the Constitution lays on the National Executive Council.
What are those conditions that must be met before you say you will or will not go on strike?
Sorry, can you say that again? I didn't get that.
What aspects of your demands must be met by who before you consider whether to or to not go on strike? Okay,
when we did talk about, some time ago, about 3 weeks ago, there was a public hearing from the National Assembly on insurance and accrual matters. We've been trying to reach out to the chairman. He's not been taking our calls. And we are hoping that in that meeting today with the minister, we're also going to let the minister know that these are our points with regards to the life insurances of our members, and also to make him understand that this is the total number of personal protective equipment you've provided so far to our members. This is what we expect you to provide, and then he'll be giving us feedback as to those provisions. We'll also make him understand that 10 days ago you did say that the hazard inducement for COVID would have been paid to 6 centers as at the 10th of this month, and that before the 17th of this month, all the other centers all around would have collected such remunerations. And at this moment, we do not have payments made to these centers, as it were. We also make him understand that we still have a lot of problems with our state tertiary health institutions. And when we now get some level of feedback from the government as, okay, this is what we've done in such regards, this is the number of personal protective equipment we've sent across all the regions in the country, this is how far we've gone with regards to the life insurances for your members and other healthcare workers, we'll now say, oh, we now have such and such to say to our NEC members that this has been done, and they will now be taking such decision as to whether to accept such or to demand for some level of improvement from what they've actually said. So we're hoping that following today's meeting would have so much progress, and so the work can progress, you know, and all that.
In addition to that, I mean, you've talked about some of the states that have responded. Others are late bloomers, as it were. So at what point will the NARD say, listen, we've had it up to here?
Yeah, I'll put like 2 states into consideration. Look at the state, like Delta State, where I come from. The governor of Delta State was exposed to COVID-19 and he was treated by health workers. Okay? Sequel to that, what happened to their remuneration? They are just normal basic salaries. They were even slashed. So if we are talking about all of these, we expect some governors that have been exposed to to this COVID and has seen the level of work that the Nigerian healthcare workers are putting to combat this menace, COVID-19, we think and we expect that they should put in so much into commitment, into welfare packages for these members that are putting their lives day and night, toiling and suffering for the better, for the good of their people. So we're calling on all those state governments to say, please, come on board, do something better, get better at what you do. Your promises are quite flimsy. We need you to hit the ball where you're supposed to hit the ball. Don't just glide on waves. Hit the ball where you're supposed to hit them. So when we get these governors to actually do what they're supposed to do. At this point, I also have to thank the DG of the Nigerian Governors Forum and the chairman of the Governors Forum. They've tried to talk to all the governors all around the states, and we're hoping that these talks should continue because we do expect them to actually put so much more into the health system so that the health system can be stronger and we do not have to always fly people abroad, you know, for every slight illness because they're not done so much for your local center. So we expect them to put so much money, funding, research, training. We need them to do so much more. So we're expecting that they will do this, and you know, in no distant time, our health system should be stronger, and we hope and pray that they will just do all of these that we are demanding at this point that they should do. We're trying to tell them to do their jobs, actually, you know, as it were. So we just expect them to do their jobs.
Of the 5 demands that you have listed out, conditions upon which you will not go on strike if they are met, 4 of them are for they are concerning remuneration of one way or another, payment of allowances, payments of residency training. Only one of them has to do with poor health infrastructure and funding of the healthcare system. In that light, do you want to talk to us about the kind of collaborations you are having with other healthcare workers in the value chain of medical services in Nigeria outside of doctors? Because one would expect that, I mean, if you are interested in infrastructure, health infrastructures in Nigeria, you'll be speaking to those other collaborators as well.
Yeah, there's been so much cerebral discussions with other members of other healthcare workers unions, as it were. We have good discussions with the Nigerian Association of Nurses and Midwives. We also had good discussions with the Pharmaceutical Society of Nigeria. We've also had discussions with the joint health sector unions. You know, we've had so much discussions, as it were. I also would like to draw your attention to the fact that the COVID inducement allowances is not just paid to doctors alone, they're paid to all healthcare workers. Okay, prior to that time, there was a discussion, or I put it better, as saying that there was this roundtable discussion that had members from the representatives from the Nigerian nurses, from the pharmacists, the other allied healthcare workers.
All right,
it
Dr.
wasn't
Jibo.
just a discussion between the NARD and the NMA. No, it was a discussion that had to do with every healthcare union, as it were.
We have to anchor on this point.
In talks, and we will never stop talking with them, because we do know that for
that's good to know.
A stronger
Dr. Julian Ojebo
position, you must have this
First Vice President
with other healthcare
of NARD, and it's also, I've heard you say several times, you're not strike mongers, you're discussing. So it's good to know that you're not embarking on strike anytime soon in the near future. So thank you for talking to us this morning.